Hi everyone, we're back, and the topic for discussion today is plastic and reconstruction surgery. I know that when we talk about plastic surgery, people often think of things like liposuction and breast enhancements, and there's nothing wrong with that. It is plastic surgery after all, but there is that section of plastic surgery which is not commonly discussed. Let's take, for example, the baby born with a cleft lip or cleft palate. This is also an indication for plastic or reconstruction surgery, and sometimes these babies may have such problems depending on how bad this area, the separation is with the cleft lip or cleft palate. They might have trouble with swallowing, they might have trouble with ear infection, so these are real problems. And eventually the cleft palate has to be repaired, or the cleft lip, not to speak of how disfiguring it even looks. Next we're going to go on to something I don't know whether you've ever heard of, Le Fort fractures. These fractures can be from 1 to 4. They may be as simple as just a little bit of swelling to the lip, all the way to complete craniofacial separation. Let's take the case of this patient above. It's usually caused by direct impact, who had a direct impact to his face in a car accident, and he now has what is called a Le Fort fracture 3. Like I said, there's 1, 2, 3, and 4. At 3 you get craniofacial separation. Reconstructive surgery will have to be done, and the patients that I've seen with this problem, they have what is called, they wire the jaws to get the jaws to heal again, and they're very limited. I've seen on occasion where they just get a straw to suck from, depending on the damage, or they may not be able to eat and drink at all. Just keep the mouth clean. So that's where things like TPN and enteral feeding comes in to complement when they cannot eat. And when I say enteral feeding, it may be done like up to a peg, which is not going through the nose or mouth, where it goes directly into the stomach or the jejunum. Next we're going to talk about the burn patient. And people sometimes do have extensive burns. Take the case of Sam, who is being treated for burns. As you can see there, the skin is pretty damaged, and he's going to have reconstructive surgery. Skin grafting is what is done. You have the donor site where the piece of skin is taken from, and then you have the grafting site where it's applied to. And even when these patients have this done, one has to be very careful because infection can set in. Separation, sometimes those grafts don't always take. So usually at work we used to have to check them frequently according to the doctor's instruction for things like warmth and discoloration, and you have to check for infections and document it very carefully. You might have poor healing, especially if it's somebody who already has problems like a diabetic. And autograft, healthy skin taken from another area of the body to put in that area is what it's called. Now let's move along to another problem, and I've seen this happen where patients have had reconstruction. This patient, she's diagnosed with squamous cell cancer of the tongue. She's scheduled for surgery and is feeling very anxious. Not a doubt. Who wouldn't be feeling anxious to have your tongue partially removed? She's surrounded by family and friends. She's aware that plastic surgery and reconstruction is necessary, and she's concerned about not being able to eat and drink. Her taste buds also being affected. And again, like, there is no hard and fast rule. There are people who have plastic surgery of this nature, and it's less complicated. Some people have more complications. Some people have more that has to be removed. Some people have less. Whatever it is, my suggestion is that during that crucial period when somebody's admitted to the hospital, they need a lot of emotional support and, of course, family patient education. So bear with them. Try to do the best you can. Hope that you've gained from this. Have a great day.